Isolation is a common human experience. We all feel it sometimes. It can be caused by many things like moving to a new city or losing a loved one. It's normal to feel lonely or sad when we're isolated, but did you know that long-term isolation can be bad for our mental health? It's true. It can lead to problems like depression and anxiety. Isolation is especially hard on older adults. They might not get out as much. This can be due to health problems or living alone. This lack of social contact can hurt their well-being. Studies show that social isolation can be as harmful as smoking. It's a serious issue that affects many people. Now imagine the impact of isolation on individuals already facing cognitive challenges. That's the reality for millions living with dementia. They rely on routine, social interaction, and physical touch to navigate their world. Let's explore how isolation affects these vulnerable individuals and why it's crucial to prioritize their well-being. Dementia is a cruel disease. It slowly steals a person's memory and cognitive abilities. This makes it hard for them to do everyday tasks. They might forget familiar faces or how to get home. Imagine how scary that must be.
People with dementia rely heavily on routine and familiar surroundings. These things provide a sense of comfort and security. Physical touch is also vital. A hug from a loved one can be incredibly reassuring. It helps them feel safe and connected. However, when these vital elements are taken away, the consequences can be devastating. The COVID-19 pandemic brought this issue to the forefront, exposing the fragility of dementia care and the urgent need for a human rights-based approach.
The COVID-19 pandemic was tough on everyone, but it was especially hard on people with dementia and their families. Lockdowns and social distancing measures meant limited visits from loved ones. This isolation was incredibly difficult for those who thrive on social interaction and physical touch.
Imagine being unable to hug your loved one when they are scared and confused. It's heartbreaking. Sadly, many families experienced this during the pandemic. The lack of familiar faces and routines led to a decline in the cognitive function and well-being of many dementia patients. In some tragic cases, this isolation even contributed to premature deaths. The pandemic highlighted the urgent need to protect the rights and well-being of vulnerable individuals, especially during public health crises.
The Human Rights Act of 1998 is a vital piece of legislation. It protects the fundamental rights and freedoms of everyone in the UK. Two articles are particularly relevant when considering the treatment of dementia patients during the pandemic. Article 2, Right to Life, and Article 3, Prohibition of Torture.
Article 2 protects the right to life. This means that everyone has the right to live with dignity and not have their life taken away unlawfully. Article 3 states that no one shall be subjected to torture or to inhuman or degrading treatment or punishment. While physical torture is clearly wrong, what about the psychological suffering caused by prolonged isolation? Could the isolation experienced by dementia patients during the pandemic be considered a breach of their human rights? These are serious questions that demand further examination.
Section 5, the Scottish Co-Inquiry, A Glimmer of Hope. The Scottish Coronavirus Public Inquiry, also known as the Scottish Co-Inquiry, is investigating the handling of the COVID-19 pandemic in Scotland. One of its key areas of focus is the impact of the pandemic on care homes, particularly on residents with dementia. The inquiry is examining whether the human rights of care home residents were adequately protected during the pandemic. It's also looking at the adequacy of the government's response to the crisis in care homes. The inquiry's findings could have significant implications for the future of dementia care in Scotland and beyond. It's a crucial step towards ensuring that the human rights of vulnerable individuals are prioritised in all aspects of public health policy and practice. Section 6. The long road ahead, protecting the vulnerable. The COVID-19 pandemic exposed the vulnerabilities of our healthcare system, particularly in how we care for those living with dementia. It's clear that we need a more compassionate and human rights-based approach.
This means ensuring that individuals with dementia have access to the care and support they need to live with dignity and respect. This includes providing opportunities for social interaction, physical touch, and personalized care that meets their unique needs.
We must learn from the mistakes of the past and work towards a future where the human rights of all individuals, regardless of age or cognitive ability, are protected and upheld. Section 7. Rethinking Care, a human rights imperative. Moving forward, it's crucial to rethink how we approach dementia care. We must move away from a purely medical model and embrace a more holistic approach. This means recognizing the person behind the diagnosis and valuing their individual needs and preferences. Access to stimulating activities, meaningful social interaction, and trained caregivers who understand the complexities of dementia are crucial. But beyond these practical measures, we must also foster a culture of empathy and compassion in care settings. Every interaction with a dementia patient should be guided by respect for their dignity and autonomy. Section 8. The power of human connection. The pandemic highlighted the profound impact of human connection on our well-being, especially for vulnerable individuals like those living with dementia. Physical touch, a warm smile, or a listening ear can make all the difference. These simple acts of kindness can reduce anxiety, promote feelings of safety and belonging, and even improve cognitive function. We must prioritize these human connections in dementia care, recognizing them not as luxuries but as essential components of well-being. By fostering an environment of warmth, compassion, and genuine human connection, we can create a more supportive and fulfilling experience for those living with dementia.
These small moments of connection, they really do mean the world to us. It's not just about care, it's about feeling seen and valued.
Section 9. A call for action advocating for change. Creating a more just and compassionate system of care for dementia patients requires a collective effort. We must advocate for increased funding for dementia research, training for caregivers, and the development of innovative care models that prioritize person-centered approaches. We can all play a part by raising awareness about the challenges faced by those living with dementia and their families.
Support organizations working to improve dementia care. Volunteer your time at a local care home. Every action, no matter how small, can contribute to creating a more inclusive and supportive society for those living with dementia.
Section 10. Conclusion. A future of dignity and respect. The COVID-19 pandemic was a stark reminder of the importance of protecting the rights and well-being of our most vulnerable populations. People living with dementia deserve to live with dignity, respect, and access to the care and support they need to thrive. By prioritizing a human rights-based approach to dementia care, we can create a future where everyone, regardless of age or cognitive ability, is valued, respected, and supported. Let us learn from the challenges of the past and work together to build a more just and compassionate society for all.